Have you been on the bench press and at the top of the movement, you feel this searing pain in your shoulder, almost making you want to drop the weight, and then you go home that evening and you go to take a cup out of the cabinet and you feel that pain again? That could be shoulder impingement.
Yeah. And if it sounds like something that I'm dealing with a client currently who just started back, and funny enough, they came in with a knee issue that we were able to resolve. We're talking about 10 years of surgery, 10 years of pain solved within 6 months. Working with as a PTA assistant, physiotherapist assistant. Now he's coming in with shoulder injury from some yard work.
So sounds like impingement.
Yeah.
Let's do a quick anatomy lesson. So you've got 4 joints in the shoulder complex. One of them is a pseudo joint. You have the ball and socket joint first off, the glenohumeral joint. You've got the collarbone as it articulates with the shoulder blade, as well as the breastbone. Then you have a pseudo joint, which is very important. This is the shoulder blade as it moves along the rib cage. Okay. Now, impingement is really what we're talking about is encroaching on these tendons and tissues inside the joint. So under the roof of the shoulder, this acromion bone, we have the rotator cuff tendons and we have a bursal sac. Now, what happens is if the shoulder blade is not moving properly and upwardly rotating, then you get compression. And over the course of months, thousands of repetitions of compression, eventually the body perceives threat and these tissues get inflamed.
And that's exactly what we're seeing, because it seems like he had his transformation. He got a new job, and in that transitional period, training wasn't something that he could make as a priority anymore. But now it's at a point where he's being forced to come back because that inactivity showed up in chronic injury due to that lack of stability in that shoulder girdle, which then now we're seeing that impingement feeling. So we started with just watching like shoulder rhythm. So as he glides, what happens to the scap as he's moving about or on the ribs, to see if there's any sticking points. At what point is he actually experiencing that tension and that pain? Regular sort of assessment and movement screening, and then working through to then get the shoulder to feel safe again, to reduce that perceived threat.
That's great. That's great stuff. Another thing you probably want to look at is his thoracic extension.
Yes.
And potentially thoracic extension with rotation.
Right.
Yeah. If you think about, if you viewers at home want to try this, you can sit down or stand in like a slumped position and try to raise your arm and see how high you can actually raise it. Then try to extend your thoracic spine and see how much higher you can move your arm. And that is very important. So a lot of people are stuck in that forward position.
Yeah, driving all day. He works in an office. You know what I mean? A lot of symptoms you hear attest to, like upper cross syndrome, that sort of thing, where everything is in the front. Everything is internally rotated. Everything is closer into the midline of the body. And what we're working on right now is to open him up a little bit more, externally rotate him to get him more comfortable in the plane to get him more comfortable in the action that he's not used to.
Right.
You
can look at lat tightness.
Oh, that was like the first.
Right.
Because like even holding, so we had a band attached to like a pull-up bar, and we had him in a knee bent position, and even just that, like you could see the fibers resisting because it was that rigid.
You could even look at long head of the bicep.
Okay.
That could also be tight because that attaches right into the shoulder.
Right.
That tendon is often one that is irritated
right.
in shoulder impingement, right?
So what would you do? Is that the same thing for this like external rotation there to then open that up, or is that a more specific?
Well, you can stretch the bicep. There's a really good stretch. You put your hand on the wall, kind of like if you're doing a pec stretch, but you place this part of your hand so you're in a pronated position, okay, your forearm, right on the wall, and then you turn away, and you'll get really good stretch on the bicep, loosen that up, and often that actually really helps.
Okay.
Yeah.
And guys, if you want more information or more in-depth look on some client work that Adam and myself have done on the topic of shoulder impingement, be sure to check out our podcast on all streaming platforms, more commonly Spotify, Apple, at BRS, Beyond Reps and Sets, everywhere.